Hello, everyone. Welcome to the Pet Business Podcast. I'm Dr. Qureshi with over 30 years of veterinary practice experience. And today we'll be talking about cats and cat diseases, what are the common illnesses, and some preventative care around that. Hi, I have with me Sean.
Hello.
As a beloved pet owner. And go ahead, Sean.
Thanks for having me here again, Dr. Qureshi. I do have two golden retrievers. Love animals. I love cats, although I'm allergic. So I'm not around cats all that much, just kind of by necessity. So this topic is very interesting to me. I'm looking forward to learning about care for pets. A lot of my friends, they have cats, and it'll be really informative for me, I think. So what kind of, for cat owners, what kind of things do they have to look out for, or for illnesses in their cats?
Right. So, the common condition we see in cats is obesity, urinary tract disease, kidney disease, diabetes, dental issues, foreign bodies,
my goodness.
and some skin conditions and all that. So, these are some of the conditions we see day in and day out in a vet hospital. And I thought I bring those ones in. We'll discuss a little bit deeply into each, what are the signs and symptoms of each condition, what to watch for and everything as a pet owner. So let's talk about diabetes.
Okay. Yes.
Diabetes is a preventable condition in cats and dogs, but especially in cats. And that usually it could be a genetic component, but mostly it has to do with the lifestyle.
Okay.
Majority of our cats, they nap 22 hours a day out of 24 hours. And also they get obese. So obesity and diabetes go hand in hand. So before I dive into the signs of diabetes, let's talk about obesity in cats.
And about nutrition?
About nutrition.
Sure.
We touch base on that. So, after so many years in practice, and I've done some house calling in my early years of practice, and I used to go into people's places, and every room has a food bowl in there for a cat and a water bowl. So I think in general, same thing in people. If you're snacking all day, if you have 3 meals a day, and you don't exercise and you don't have an active lifestyle, you're going to gain weight. That's not. So pets are the same way, especially cats. If the only place they have to walk is around the corner where they can go to the food bowl, and that's where they're going to go to, and they're going to nibble, they're going to eat all day. And if the bowls are everywhere in the house and there's no time feeding or is, ad lib, like ad lib means that the food's going to be constantly there and they're not going to be getting much exercise or anything, which then they're going to get overweight.
Sure.
So just to give you an idea, what is overweight for a cat? You may have this question, how to tell?
Right, yeah, of course.
So for a female cat, spayed, neutered, cat who is a female and a male. For a female cat is 8 to 10 pounds. A domestic short hair, an average cat breed, right? And for a male, 10 to 12 pounds.
Okay.
But with experience, I can tell you more than 50%, and that's the statistic all over North America, more than 50% of our household cats are overweight.
Really?
Yeah, and that's due to calorie-dense nutrition they get and the free choice feeding throughout the day. I'm not going to even go over what you're feeding and all that there because I don't want to create any controversy here. But maybe in the future episode when I talk about nutrition, I can give you some guidelines. But I think you always want to feed a good, palatable, good quality diet. I'm talking about when I say good quality, good protein source, maybe a premium brand food, dry or canned, whatever you choose, but it has to be a limit to it.
Right.
And you can get those guidelines from your veterinarian. don't rely on Dr. Google. And I think your veterinarian, your vet team is the best resource to give you that guidance for your situation, your lifestyle, your cat in your house, how much to feed and all that. But one thing I can tell you experience is free choicing for cats is not a good idea because they don't know when to stop. It's like,
Right.
is when you're in the house in COVID, a lot of people gain weight because fridge was just 4 steps away from it.
Absolutely.
And so same thing with cats, if the food is there all day, and that's a controversial topic. A lot of people, even the nutritionist and vets say, cats are nibblers, food should be there all the time. So if you want to do that, make sure to limit the quantity per 24 hours and then start the next day. So if you say measure, say an average cat needs maybe half a cup of dry food a day.
Okay.
And maybe you want to give them a quarter of a small can. That's the full nutrition, for example.
Right.
You want to spread throughout the day and don't give any more and then start all over again with the new. So for 2 reasons. One is that they will get a limited quantity per 24 hours.
Mm-hmm.
Second thing is that the food stay fresh because a lot of people don't understand that food sitting at the room temperature, because there are fats, proteins, nutrients in there, so the value of the nutrition is still not the same because the fat attracts moisture and all that and get rancid.
Oh, okay.
And the food is not good. The cat's not going to tell you that. You will only know if they start vomiting or have diarrhea because they eat a bad food. So you have to feed fresher food, smaller quantity per day, limit the amount after speaking with your veterinarian. Okay? But in practicality, that's number one if you want to keep your cats not to be obese.
Right, because obesity leads to health problems.
Yeah,
like
and then
diabetes.
if you have time, a lot of the people have a fencing area where they can take the pad, they can get exercise. But even in the house, play with them like you play with your dog, have those light, some kind of activity. There are a lot of cat toys available now which keep them motivated and exercise with them. So a little bit of activity is a good idea even with your cats. Okay, so that's about obesity. General guideline, we can get more into that when I talk specifically nutrition in my other episode. And then, second topic is the urinary tract disease. And this is common in male cats mostly.
Okay.
And, this is the most commonly seen in vet hospitals. Why? Because male cats, if eating a poor quality food, not enough water or water from a poor source, they get overweight, they are stressed, because stress for a cat is anything.
Right.
Looking at the birds outside and get that, then they can't get out. Loud noises, doorbell rings, they run the other way. Sure. Many stresses for cats, in the house because, and so there are a number of factors which can bring in this condition. And what happens is the sign you notice at home is all of a sudden male cat is not using the litter box, or they have small quantity, they're going in and out of the litter box, or you notice a blood in the urine on the floor. If your carpet sometimes is missed, but on a floor, tiles or something, you see blood in the urine, then you know that there is infection in the bladder. So, this is such a common condition, and these are the signs and symptoms. So you should pick up, don't wait too long. If you notice any of those things, and bring it to your vet, and they will do a urine test, they will examine your cat and diagnose that condition, because that could be a life-threatening condition if you wait too long. If your cat is not peeing normally, which you can see in the litter box, whether there are big clumps there or and there's a blood in the urine, and your vet will let you know to diagnose it by urine test and X-ray and all the other modalities available to them. Any question about that, Sean, so far on the obesity and urinary tract disease?
No, it does sound, we talked in a previous episode about preventive care.
Right.
And again, this is going a long way toward keeping a healthy pet. But it also does sound like, an illness such as a urinary tract infection, like you said, it's not something to wait on. Like as soon as you see the warning signs, contact your vet. Make sure it can get looked after. I like most urinary infections with cats are treatable though.
Yes. If you diagnose early with any illness, for people or pets, if you diagnose early, is 100% treatable and preventable.
Right.
Actually, it's preventable too, because after it's treated and managed by your veterinarian, they can put the kitty on special diet.
Sure.
You keep the weight under control, try to reduce the stress, and you'll get the full guidance about the prevention if you follow it. And then they should not have a disease. Sometimes there's a recurrent problem with this, and that's nothing to do with how your pet was treated. About that is the compliance from the pet owner. Sometime they feed the food for 4 to 6 weeks and then stop, and then the problem reoccur, and they say, oh, my kitty's fine, but it's not. So it's kind of a lifelong prevention if once they get it.
Okay.
There are some genetic factors to it. Some studies are that they have a narrow urethra, and there's some controversy around spay them or neuter them earlier. But, whatever's in your hand, you could do to prevent. We all blame things in genetics, but I think that's maybe less than 20% or so. Most of the illnesses you can prevent by nutrition, weight control, and life stage choices and everything, and prevention.
That's great. It's like the old saying, an ounce of prevention is worth a pound of cure. Right. Are there other illnesses in cats that are readily present that you've seen in your experience, in addition to obesity and urinary tract infections, diabetes? What other kind of health issues do you run into?
And that all depends upon their age as well, and dental disease, which is under-recognized, and a lot of people don't know about it because cats not going to say, you only notice if they're drooling a lot, or you see some of the symptoms, blood, coming from the mouth, or they're pawing at their face because it hurts. They have a sore tooth, and that can happen any time between middle-aged cats to older cats. So those are the signs. But if you're going to your vet once a year, which you should be going on a preventative care, they should be able to diagnose that or say, okay, your pet has plaque and tartar buildup there. I think maybe in 6 months or a year, your pet going to need a dental scaling and polishing and everything to keep the mouth healthy. Like we go to our dentist. We don't go to our dentist when we start losing our teeth. We go for prevention. You know what I mean? Once a year we go, so we don't get into that condition. But a lot of the time, unfortunately, with us, with cats and dogs, people come to us when it's already getting late.
Oh,
so then we have to jump into not only fixing the problem, which is extracting the bad teeth and cleaning the teeth and recommend prevention. But anytime you notice, I think, in my opinion, you shouldn't be even noticing any symptoms of dental disease. I think that's a preventative thing.
Okay.
We can prevent easily by your regular visit to the vets. Okay? And the other thing is, of course, diabetes. Diabetes is big in cats because, again, lead in obesity.
Right.
And that can lead to the signs and symptoms are the increased drinking, increased urination. You get larger clumps in the litter box. So that they're peeing a lot. They're drinking a lot of water, always at the water bowl. They don't eat that well. They're losing weight. The fur is not as good because they're not grooming themselves that good.
Okay.
But having said that, these signs are general. They can be for many other diseases, like in kidney disease in a cat, older cat. That could be the same signs. Bad breath, losing weight, increased drinking, increased urination, and everything. So if you notice, your cat has any symptoms of vomiting, diarrhea, increased drinking, increased urination, coughing, sneezing, maybe looks thinner when you pick it up. Their coat looks rough. They're not grooming themselves and everything. Then I think you should see your veterinarian so they can examine your pet, run diagnostic, do a good physical examination so they can diagnose an illness. And so I'm a big fan of prevention.
Sure.
I hate to go over some of the signs and symptoms, what the illnesses are. I think if a cat owner is going regularly to their vet,
Mm-hmm.
they should talk to you about how to prevent some of those conditions so you don't go back to them when they're really life-threatening and everything. But unfortunately, we still see those ones because people not always follow the recommendation. Like we don't follow the recommendation for our doctors. Sometimes we get into trouble.
Right. And it's like you've mentioned a few illnesses here, and like you've just reiterated, the symptoms they're almost all the same. A lot of urination problems, blood in the urine, frequent urination. You're talking about vomiting and diarrhea. It's exactly why Dr. Google is the worst for cats.
Right.
Because you're going to see like almost every possible illness. And the only way you're going to get a proper diagnosis is from your vet.
Right. Exactly. And we are, but Sean, after all those years, I must tell you, when you go to see your vet, don't be easy on them. Put them to task, but you have to provide a good history.
Okay.
What the pet's diet is. Be honest with your vet. How often they eat. Who lives in the environment. What the lifestyle of the pet is, cat or a dog. With good history, then, make sure your veterinarian do a thorough exam. I call it from head to toe or head to tail.
Head to tail, right?
Or nose to tail. So they check everything, because I find over the years, you can run all the blood tests, you can do all the diagnostics, but if you have a poor history from the pet owner as a veterinarian, or you don't do a good examination and you miss things,
right,
you're not going to reach to a proper diagnosis because blood work or x-rays and other fancy tests not going to be able to give you all the answers. So I, over the years, always have focused on listening to people.
Okay. Because
a pet owner can tell me a lot, and with my experience and my physical exam, I can check everything, and that's what the art is.
Right.
There's a science of veterinary medicine, and there is art to it. And a lot of the vets who are in practice for that long, they use that art too, not rely on the tools available to us. So, follow the instructions, but give them the proper information so they can make the right diagnosis. But if they're doing skipping over the exam and everything, put them at task and say, you want a full examination of pet. And when they're doing the examination, I personally verbalize everything what I'm checking.
Okay.
A lot of the pet owners, when vet is examining them, they don't understand what they're doing. They don't see the value to it. So you should ask what they're checking for. Ask questions. It's an interactive visit, right?
Yeah, it should be a two-way thing. I mean, the patient can't talk to the vet.
Yeah.
Somebody's got to talk to the vet in that case.
Yeah.
And no, I do understand because I know in previous episodes you've talked about maybe some of the stigmas surrounding veterinary medicine, about doing things that aren't necessarily necessary, and the only way that you can get a veterinarian can give that peace of mind to a pet owner would be the communication.
Communication is huge. I think I find a lot of misunderstandings between a pet owner and a veterinarian and their team is communication. It's not that they're doing anything wrong. I think when we get into this field and people who work in the vet hospitals, they're very compassionate about of pets, and that's why in this profession, they want to do the best for you. But I think where things do not go right because is the communication. We are unable to relay what we think from our perspective, and the owner does not hear what we want to tell them. So I think that communication is huge. Thank you, Sean, for bringing that up.
Oh, absolutely.
Right.
I mean, I know that I'm kind of lucky. We have very communicative vets. They also love our dogs.
Yeah.
But I like to get that information.
Yeah.
I do adhere to the philosophy you've been talking about with preventative care.
Right.
I'm sure, like, even though your profession relies on treating animals it does sound like you prefer kind of like healthy, happy animals come in just for their regular routines rather than having that like the difficult diagnosis and the heartbreaking scenes of dogs who and cats who they can come in and they've got something serious, and you know that you've got to go through a real difficult treatment, and probably the animal is probably suffering.
Right.
I know that we talked a little bit about preventive care in the previous episode, but for these illnesses you mentioned, I mean, other than nutrition, which is super important, and again, we'll talk about again later, what other preventative measures can you do for your cats specifically to avoid these diseases?
So let's go back to the vet hospital when you bring it in.
Sure.
So basically, regular vet checkover. So the question will be, how often to bring my cat? Beside the initial visits, 8, 12, and 16 weeks, and once a year visit for vaccines, I think for younger cats, what I call it, say 1 to 2 years, and then 2 to 5 or 6 years age group, and then we divide them into kittens, adult, senior, geriatrics.
Okay.
So they're life stages. You can learn that from your vet as well. Sure. That's the way we recommend preventative care. So when they're younger age, you still need to, however the cat is doing well, in their 2 to 6 or 7 years of age, but you still need to see your vet once a year because you could still miss an illness. It could be a weight, it could be teeth, it could be any skin condition or any, especially with male cats, urinary tract disease, the younger cats. 2 years and sometimes even younger than that. Oh. So that's why a yearly visit is a must. But as pets get older, they age 6 or 7 times faster than us.
Okay.
So when the cats are, I'm talking about senior or geriatric, then maybe every 6 months for a checkover. If it allows, you can take it and you can afford to take that to the vet. But once a year is a must.
Right. Okay.
Yeah. And as they get older and senior, you should also ask them to run a senior blood work on them so we can pick up some internal diseases which they don't show up externally. And on the cat preventative care, I do want to mention the cats are unlike dogs. Yeah. Cats hide their diseases well. For example, when you go to your house, your golden retrievers come and greet you and everything.
Yes.
Cats are different. You will not know they're sick because they're still walking around the house. They rub against your leg. They purr. They lie down on the bed with you. But they could be suffering with a serious illness internally. Oh. They don't show their disease. And, until they're not going to a vet, they're not regular checkovers, you cannot always tell externally what's wrong with their pet.
Oh, could be difficult.
It's very difficult.
And a little bit stressful, I think, for both cat and human.
And believe it or not, statistic in North America is that cats visit less their veterinarian than dogs do. It should be the other way around.
Yeah, from what you're saying.
Yeah. And obviously in preventative care, vaccinations, parasite control, proper nutrition, dental care, and grooming is also very important in cats, especially long hair, medium hair cats. Right. Most of the cats are good groomers, but if there's some condition there, they have sore mouth or they're stressed or they're medical condition, they don't groom themselves. So for longer hair cats, you have to brush them. So make sure that all the extra fur and everything, otherwise they will get hairball. Sometimes they can act as a foreign body too, which they can get stuck internally, and that could be, they come with vomiting and they have medical issues as well.
Oh my goodness. I mean, I know hairballs just as kind of a gross thing, but if your cat's not grooming themselves or is not groomed enough, then they all of a sudden become a hazard for their health. Okay.
Right.
Wow.
Yeah. So in summary, you're absolutely right. I'm a big advocate for preventative care, whether it's dogs or cats. But here we're talking about kitties, and especially they are known to hide their disease because, look, when they used to live in wild, if they, if they are vulnerable and they show their sickness and everything, they'll be eaten or by a predator or something like that, or they'll be killed. Right. So they go and hide
Yeah.
or they don't show, and so that's when they're living in our environment as vigilant owners, loving pet owners. We have to be really touching them and checking them and make sure that you don't see any symptoms and signs of any illness externally. But, the pets age maybe 6 times, 7 times faster, like I mentioned before.
Mm-hmm.
So a yearly visit is a must. Like if you don't
Okay.
take your cat to a vet for a year, it means you haven't gone to your doctor for 6, 7 years. And you know how many things can crop up?
Oh, yes.
Yeah. So huge. And then the second topic is that when you go to a vet, provide them a full history, and then try to make sure that do the full examination, give you all the answers, and a preventative care. So we don't have to see them when they're sick, and all those conditions, which are majority of those illnesses are preventable.
Mm-hmm. Yeah.
No.
That's what I've been seeing here.
Right.
It does seem to be really important to not only provide them with their cats with the right environment, with the right routine, but also ensure that when they are going to the vet, they are getting the right attention that
Right.
they need.
Right.
That's great. Is there anything else you'd like to share about, recognizing illness in cats, taking care of cats and their treatment and preventive care?
Yes. Yeah. And